Hello beautiful people, welcome to another video. In this video I'm going to reflect on my experience as an EVS worker as I get ready to move into kind of the CNA lifestyle. I haven't yet started the course. I actually start the course this Friday. However, I'm coming from this position of kind of like, it's a point of transition, so I want to kind of explain and reflect and see how I feel about EVS. And it came up for me today, so I wanted to share. So one of the major things I appreciate about my experience in EVS thus far has been my ability to observe. And I mentioned this as in my EVS soft launch video, but the ability to observe things without having to be an active participant has been really valuable because it allows me to view like the nurses, the patients, patient families, and kind of see certain interactions. Now obviously I'm not paying attention I'm not like eavesdropping or like watching or staring at anyone, but I do recognize certain dynamics even between nursing staff and CNA staff. I notice certain patterns in how things are done, at least on the unit that I'm assigned to, and some other units where I get floated to. So I really appreciate and value being able to like see how people interact with each other and kind of learn from that. It has made me reflect on even how I would deal with that situation or how I would deal with certain instances. It has given me a greater appreciation of what nurses and CNAs do, of course. And I believe I've mentioned this before, but I do have experience as a PCT or a patient care technician when I worked at another university hospital on the East Coast very briefly. I was trained kind of officially to be a patient care tech. However, it wasn't a certified position, which is why I'm kind of starting over again. In that position, I was able to do like phlebotomy. I was able to like take blood draws and stuff along with the kind of typical CNA role. And then here it's a little more limited. Like no phlebotomy is involved with a CNA, which is kind of like, that's fine. I don't mind that. And I might take an extra course for that, but yeah, being able to observe has been really fun, really great, and allows me to reflect passively and actively without being actively involved, which is very nice. I've also noticed that, again, there are things that I would do certain ways that I have kind of pocketed away, put it at the back of my mind for now, mainly in relation to how I was trained as a PCT. So, for example, in the rooms where there are two separate people in a room, I would definitely make the effort to label things. And I've seen this from a EVS perspective. It's really difficult to know what to throw out and what to leave when nothing is labeled and nothing is kind of set aside specifically for each patient. So I would definitely take the time to label like urinals, bedpans, like anything that each particular patient is using, because you wouldn't want to cross-contaminate that at all. I also have seen a distinction between like shifts as well. So I work in the evenings, so I kind of get the end of the day shift. I get the kind of mid-shift people. I get the night shift as well. So I see all those different fluctuations in staff, again, specifically on my unit. And I notice a variation in the amount of attentiveness that certain groups of either shifts or people roles specifically do. So I feel like with the night shift there's more younger people and they're much more responsive to call lights than say the day shift. And I'm not saying anything like bad against the day shift or any of the shifts, but it feels like that energy of maybe being younger assists with like wanting to be more helpful or caring a bit more, whereas I feel like those who've been in the profession a little bit longer have become a little more desensitized or not as quick to respond, maybe because they know certain things about the patient specifically. But for me outside looking in, it kind of looks irresponsible. And so that's something I would want to be mindful of, is like responding to how patients are cared for and responding to patients' needs, even if it's inconvenient or too frequent. Especially with the way I was trained prior, and I feel like that's the most valuable thing. My training as a PCT at the other university hospital was very significant because I noticed key differences in the standards of how the unit is run. And again, I'm not trying to say anything good or bad one way or another about one place or another, but the way I was trained specifically was like, when the call bell goes off, you answer it, like regardless of whether it's your patient or not. And you know, there was this energy of helping every patient regardless, or you know, being responsive, and I don't see that on the particular unit that I work on all the time. And it just feels like there's a little bit of a lag. And so I would definitely want to be more mindful of not like desensitizing myself. I also am aware of like how much the CNAs, the nurses run around and are doing things. And even as, you know, I want to become a nurse, I'm making notes of, okay, I'm gonna wanna have like a sticky notepad or something on me to keep track of requests and keep track of what's going on, because I am someone who gets a little overstimulated sometimes, and if I'm being asked to do multiple things, my response in my current role, in my general life, is that I'm going to respond and I'm going to do it right away. That's just how I am, because if I don't do it now, and I've said this to myself, if I don't do it now, I'm not going to do it. I am more than likely going to forget it later on unless I write it down or unless I do it in the moment. So again, making that note for myself is carrying around like a notepad, even my phone, but I don't love the idea of storing perhaps sensitive information on my phone. So carrying like a notepad or a little notebook or something to write down requests in is definitely going to be something that will be in my kind of pocket of my scrubs, or just something that I do. And then furthermore, I think, again, from an EVS standpoint, just recognizing how important it is to keep my environment clean, not for the sake of like wanting to prove I'm better or anything because I've worked in EVS, but I just feel like there's a level of unawareness sometimes, and it's definitely from rushing, but also not recognizing the little messes that get left behind or the little things that don't get done. And even the way that like things are kind of thrown or strewn all around. Like, I consider myself a type B person in much of my life, but when it comes to work, I'm very type A, and I want to keep things neat. I want to keep things organized. I want things to look presentable, and I feel like all the little stains that I see, like, so it takes like 5 seconds to clean up. And again, this is the EVS in me coming out, but yeah, just like the way to make sure that things are organized in the patient room would definitely be very important to me. Because I've worked in EVS, I know how significant and how easy it is for, you know, CNAs to leave things behind, patient belongings, and who knows if that person is ever gonna get that back. So, you know, seeing kind of the mistakes, again, I say that lightly, seeing the mistakes of the CNAs and nurses in little areas has helped me become more aware of what I would want to do. So again, cleaning up messes, especially things that are going to be sticky or something, keeping things organized, labeling things, cleaning the required things that are supposed to be cleaned and cleaning them properly, specifically the commodes that are supposed to be rinsed out, and our toilets in the patient rooms have this little like shower head bidet thing that comes down that makes it easier to clean. It's not perfect, it's not a cleaning solution, but you know, it's there. And I've noticed one too many times that CNAs either leave it behind purposely or just refuse to clean it because it's gross or it's dirty, and it's like, it's our job, you know? Like, ironically, I left my PCT position because it was like in relation to poop, but more of a behavioral thing. But when it came to cleaning patients, yes, it was gross, but I did it because it was my job and because it's for them, right? Recognizing that the patient is a person and that they are not anymore like wanting to be there or wanting you to be cleaning them than you might be, right? So just having a level of respect for them and for yourself. Yeah, so I've noticed some things that I would definitely want to be mindful of. And again, it's not to talk down about where I work or anything, but it's I'm glad that I started as EVS, because without that experience, again, there are many things I probably would have not been aware of. Especially concerning patient belongings being left behind. Not know, like, if the CNA looks in one place and not another, things are getting left behind. And so I think I would be a lot more thorough with how I search for things and just making sure that the patient family is aware of where everything is. Again, labeling everything, making sure all the belongings are put together where possible. You know, that's just the way I am, and I feel like I would want to share that. Also just being kind to patients, not like speaking down to them, not yelling to them. That's not in my personality anyway, so that's not something I would do. But yeah, like those little things of what I do in EVS and what I see from an EVS standpoint are those things that I would try to be very intentional about not doing to another EVS person as a CNA. And so I'm very grateful for that. I'm glad that I'm able to have this mindful take, not just like into becoming a CNA, but also as a nurse. And I think it's so critical. Many people don't start at the very bottom, so to speak. EVS is not the bottom whatsoever. But not many people start in a position where they have that ability to observe. And so again, I'm very grateful for that, because I've been able to see things and do things and observe things that, you know, if I had started as a CNA, I wouldn't have known, or I wouldn't have recognized it as an issue, right? Also, like medications, making sure maybe before the nurse leaves or when the patient discharges to let a nurse know, hey, you should unlock that medication for EVS, or better yet, take it out of the room. You know, if I'm going to be putting things in a linen bag, I'm not going to leave it super full. I'm going to empty it out and replace the bag. I'm going to, if the trash is all really, like, this might seem very lofty of me to say, because I don't want to assume that, oh, I'm going to have so much time, I'm going to, like, be able to do all these things, and then by the time I get in, this is a position that's like, actually, I don't have as much time as I hoped, or I don't have as much freedom as I hoped. And that could definitely be a reality. But again, it's about intentionality and it's about awareness. And I'm grateful that I have that from my current standpoint. So I will be working as an EVS worker over the next like 2 months. But starting my CNA, like learning and stuff, I feel like it'll add an extra additional layer of kind of observing in a new way, because I'll be observing from the standpoint of the information I'm learning. So that's very fun. I'm looking forward to it. It will be a review in many ways, but that PCT position was in 2022. Yeah, 2022. So it was a while ago, 4 years ago now, and I remember some things, I think some things are really come down to personality and just treating people with human decency. But I am excited about like learning the information again, getting my BLS and everything recertified, getting I've done like so many CPR classes at this point in my life. CPR and first aid, and I don't know, anything like medical related when it comes to learning just makes me super excited. So I'm very much looking forward to it. And then once I start actually learning things, I don't know if I'll actually share content. I don't know how helpful I would be to share content, but I can share my experience. As well as like, I'm not sure how well it will go in terms of filming in the institute where I'm going, so I don't know how comfortable I'll be with that. But again, I would like to share my experience and kind of maybe if I'm able to vlog a little bit. I do take public transportation, so I don't know how in-depth that would go. I'm very much an introvert, okay? I'm very much an introvert, and social situations of like vlogging in public would definitely give me anxiety, so I'm sorry. But we'll see how it goes. We'll see how it feels. But yeah, I'm excited, and I finally, again, I feel like I'm at this transition point in my life. I'm at, you know, the cusp of like the last real week of classes. I have like one more final, one more project, and then I'm done. And I have the CNA classes starting right away. Yeah, I'm very grateful to be at the end of my first education journey and being like catapulting into the next one very soon. But I'm very grateful to be graduating, but I'm also gonna be grateful for like a mental load of these assignments off my chest. I will still have classes and stuff regularly for CNA classes, and then I'll have clinicals and all that stuff, but yeah. I'm excited to learn about myself more. I find that as I learn new things, I tend to reflect on it, and I reflect on myself. And you know, even the clinicals were supposed to be in like a retirement senior home setting, so I'm interested to see if I actually find that I prefer that dynamic over a hospital. I will still be working at the hospital, but I do plan on getting a second job. However, I'm gonna talk about that in my next video. So thank you so much for joining me, and I will see you in the next video. Bye!